this afternoon. There's a lot of information out there that we want to get to and to process concerning the COVID-19 epidemic. We want to pass along what officials have learned to make sure that you are fully informed. So for our speakers today, first will be Orange County Mayor Jerry L. Demings, followed by Orlando Mayor Buddy Dyer, Dr. Yolanda Martinez, Orange County Health Services Director. She'll be followed by Dr. Raul Pino, Orange County Director of the Florida Department of Health. And our final speaker will be Phil Brown. He's the Chief Executive Officer of Orlando International Airport. After all the speakers are done, we welcome your questions. Dr. Pino and Dr. Martinez are fluent in Spanish. They'll be happy to answer in both languages. Mayor Demings.
Okay, good afternoon. Thank you once again for being here. As we begin really the 10th day of emergency activation, we are still having various challenges here within our community related to the COVID-19 virus. We are now up to 33 confirmed cases here within Orange County, and so each day that number has continued to grow, and so our efforts here are really related to trying to stop and abate the growth of the numbers here within our county. I want to begin by talking about the drive and the need to do testing. Our various test sites hopefully will be online very soon. One will be on the Alafell Trail area, and it is scheduled to open tomorrow. It will be run by the Florida Department of Health, and you will hear from Dr. Pino in just a few moments, who will share additional details about the opening of that particular site. The second site, as you know, the governor announced today regarding the mass testing that will be done at the Orange County Convention Center, is not slated to begin until Wednesday of this week. The opening of these sites is really important to all of us, as testing is really the key to perfecting our response and mitigation plans. It is important to note that these sites will be open for very specific individuals that Dr. Pino will cover in his comments to you. In a moment, Dr. Yolanda Martinez will provide more details on local hospitals. On Friday night, a countywide curfew was declared. Sheriff Mina and I want everyone to know that the curfew is not intended to be punitive, but it is intended to really restrict movement within our community in pursuit of stopping the spread of the virus in our community, and at the same time offering some crime prevention assistance. Since so many of our businesses are closed for business, we really want to limit the movement of personnel here within our community. Under the rules of the Orange County curfew, residents must stay home from 11 p.m. until 5 a.m. with few exceptions, which include primarily healthcare providers, first responders, and government employees. Then there are individuals who obviously are out working, individuals who are truck drivers and others who are moving goods and supplies throughout our community. It's not intended to restrict those individuals from doing their work. If you are working or traveling, or if you're going to and from work, you are not in violation of the curfew. Beginning Monday, the lobbies of the Orange County Sheriff's Office, Central Operations, and sector substations will be closed to the public. We ask that you check the OCSO.com website for additional information in that regard. Because of the hardship in our community caused by furloughs and work stoppage, we are offering COVID-19 rental assistance to residents of Orange County. This is a one-time benefit for 1 month's rent assistance for Orange County residents only. Orange County government has established a crisis assistance hotline, and I'm happy to report that we will begin taking calls at that hotline tomorrow at 8:30 a.m. And it will continue until about 3 p.m. tomorrow. So if you are in need of assistance for rental payments, utility payments, and you're an Orange County resident, we ask you to call 407-836-6500. And I'll repeat that, 407-836-6500. Hours, again, will be between 8:30 a.m. and 3 p.m. If you need additional resources, then certainly you can reach out to us via our OCFL.net website /coronavirus. Appointments will not be given to Orange County residents who remain on payroll from their employer. In other words, if you want crisis assistance and you're continuing to be paid by your employer, you will not be eligible for these emergency funds. This is for individuals who have lost their employment, they're on furloughs without pay, etc. In addition to the current policy regarding the special assistance, we will be suspending disconnections for non-payment to Orange County utilities, and that's Orange County utilities will be suspending late payment fees until further notice. I'm going to shift a little bit and talk about our Parks Department. As for Parks and Recreation, we are closing down our spring camps located at the various sites throughout Orange County after the end of business tomorrow. Tomorrow, Monday, March 23rd, we will be suspending any of our activities related to the spring break camps. In addition, we are closing camping sites, our 11 boat ramps, and all activities at parks such as Kelly Park's Rock Springs Run. It's a pretty popular park. That will close at dusk tonight. The goal, again, is to keep crowds to a minimum. Orange County government remains open only for limited essential services in which individuals can go into our various facilities. Most of our business will be conducted online. Some buildings, like our utilities department, have closed their lobbies. If you need to come to Orange County government facilities, we ask that you check our website to make certain that you can go and engage or interact in person. That is, again, the OCFL.net. And finally, I ask that everyone continue to practice social distancing at all times and be mindful of the unnecessary trips and social interactions. Please remember that in times of stress, we realize that anxiety can be a bit overwhelming, but there is help that is available to you. We're calling on the members of our faith-based community as well as our mental health professionals to assist us with this. You can call 211 and get assistance and referrals for any type of mental health counseling here within our community. Aspire Health Partners is also offering a hotline or helpline to assist residents with mental health concerns related to COVID-19. Residents can call the helpline to be connected with a mental health professional by dialing 407-875-3700 extension 2. That's 407-875-3700 extension 2. At this time, I'm going to ask Mayor Dyer to come forward and share some additional thoughts with you from the City of Orlando. Mayor Dyer.
Thank you, Mayor Demings, and I want to thank the local press that's here today for helping us continue to get out local information. We have at least a press conference a day from the White House and usually from the executive office of the governor. But it's important to our residents that they understand what's going on in their community. So thank you for being out here today. We're living in unprecedented times, and life is not going on as usual. But as we continue to experience the initial impacts of this virus, we unfortunately know that it's going to get worse before it gets better. So I want everybody to get mentally and emotionally prepared for the fact that it is likely to get worse before it gets better. While we continue to have these initial contacts, we are certain that the actions that we are taking as a community are helping to flatten the curve of infection and stop the spread of this virus. We will continue to make the best decisions that we can with the information that's available to us, but we know that we'll continue to take the needed action to stop the spread of this deadly virus. As to the city government, we've undertaken several serious measures already. We have most of our employees working remotely starting last Wednesday. Friday, we closed all city offices to the public. That includes City Hall and our city administrative buildings. During this time, we want you to know that your city is still working for you. Essential employees like police, fire, wastewater continue to provide those services. Residents needing assistance can use the phone to interact with city government and access over 290 city services in that fashion. Our outdoor facilities, such as our city parks, Lou Gardens, and Dubs Red Golf Course, are open to the public, but we want to stress that we want our residents to follow the necessary social distancing measures while they're there, but we understand that our citizens need some outlets, an opportunity to use the outdoors for fresh air and exercise, for mental and physical health things, but especially let's maintain our social distancing. I do want to report as to some of our firefighters and police officers. On Friday, 4 of our firefighters interacted with 2 different patients that we were told later on that were infected with the coronavirus. So those 4 firefighters are now self-quarantining. They are showing no symptoms. We have a police officer that has been quarantining for about a week that received notice today that he has tested positive, so we're taking the necessary steps with that. I want to salute all those that are working on the front lines in our communities, the first responders, our healthcare workers, our bus drivers, our workers at grocery stores and pharmacies, our teachers. I want to applaud their dedication and their heroic efforts. We know that we're a resilient community, and we'll know that we'll get through this. Our residents have been amazing as they have stepped up and followed the directions. We know that we're still at the beginning of this, and we've got a while to go. So I just encourage everybody to know that you're making a difference. And with that, I'd call on Dr. Martinez.
Thank you, Mayor. Good afternoon. Today we want to continue to remind all of our residents to please practice social distancing for yourself, for your loved ones, and for the rest of the community. And when we say social distancing, we mean at least 6 feet apart as you're facing each other and trying to communicate. I know that in the past we've talked about vulnerable communities, and we've talked about those that live in nursing homes and assisted living facilities, but we want to remind everybody that not only those individuals are in danger, that we also need to think about those that live at home, your parents, your grandparents, people that are over 65 and that have compromised immune systems. Also think of them as you go through your daily life and as you approach them. For me, it has been particularly difficult that for over 2 weeks now I have not been able to hug or kiss my mom, but we need to remind ourselves that we're doing it for them and they understand it as well. Emergency rooms, we want to remind everybody that unless you're really in a distress situation, suffering chest pain or shortness of breath, to call your doctor first. If you feel that you have the flu-like symptoms, call your doctor first for guidance before you show up to the emergency room. And then we have messages from our hospital partners who have asked us to remind the public that they're making modification to their visitation policies in order to minimize the risk of infection for patients and to protect hospital staff. From our partner Advent Health, effective Monday the 23rd, no visitors for socialization purposes will be allowed inside Advent Health hospitals in Central Florida. Visitation will be continued to be for special circumstances, such as power of attorney or medical decision-making, or for end-of-life circumstances. Advent Health will limit the surgical care of patients to those who have needs that are immediately life-threatening and with malignancy, for example, progress of active symptoms. If you are scheduled to have an elective surgery in the next few days, we recommend that you contact your doctor to make sure that that is still scheduled. For access of more information, please visit the Advent Health website at coronavirusscienceandsymptoms.com. Also, our partner at Orlando Health is strengthening guidelines for surgeries, procedures, and visitors, so effective immediately. Orlando Health is suspending routine visitation in its hospitals until the transmission of COVID-19 is no longer a threat to the community. These guidelines were developed to enhance the health and safety of patients, visitors, and care teams, and to support social distancing. For them, you can get more information at www.orlandohealth.com/COVID-19. We also want to remind, and as Mayor Demings mentioned, the testing, the drive-through at the Orange County Convention Center that is being run by FEMA. It will start sometime midweek, as the mayor mentioned, Wednesday. And for more information, for criteria for testing there, Dr. Pino will provide some information, or you can go to ocfl.net/coronavirus. And finally, we wanted to let everybody know that shipment of supplies are slowly trickling in. Today we received a small shipment of some supplies limited to PPE and other medical supplies that will be proportionally distributed based on the needs of our partners as they have expressed them. And now I would like to turn it over to Dr. Pino, Health Officer, Florida Department of Health in Orange County.
Thank you, Dr. Martini. Good afternoon. I would like first to thank the employees of the Florida Department of Health in Orange County who continue to work as we speak to provide the services. And I want to thank our mayors for the immense support to our activities. With that, I would like to turn it into our services first. Although we have diminished the way that we provide services and we will adapt to the situation, the Department of Health fully continue to provide all the services that we have provided, including WIC and certification for those in need at this point. So if you are in need to apply for WIC, we are open for business, as well as all our clinical services. We are just changing the mode that we provide those services, and we ask the community to call our numbers that are listed online before you go to our facilities so that you are seen in the mode and form that you need to. Testing. The Department of Health will be opening its testing site tomorrow in Alafaya Trail. The number to call to make an appointment is our calling center, which is 407-723-5004. We are going to adhere to a strict criteria from the CDC for testing. We have a limited number of supply. So you know, someone drove 2 hours today to another county to get the test kits that we need to do testing tomorrow, one of my employees. We only have 150 test kits, and we are not guaranteed that we are going to receive any more. Although we are in the priority list, the supply chain has been altered, as you know, and we will be getting more supplies. We just know how regular those are. So it could be that we start testing today, we consume the first test kits in a couple of days and may not have replacement in place, but we will keep the public informed. The testing criteria that the CDC has in place today, that could change, but today, is people who have been with symptoms, either exposed to a non-positive person or either traveled to one of the hotspot areas that include now in the United States. And we are going to test anyone who is 65 years and older who has symptoms independently of their travel history or exposure history if we know that they have a chronic condition. Those are the three groups that we are going to be prioritizing for testing. When you call the health department, they will go through a group of screening questions to determine if you can be tested or not. When you receive your appointment, you will be given an appointment and advised to go to the place and stay in your vehicle, not to go inside the building, and you will be called when you come for appointment. It will be a hand washing station outside the facility where everyone will wash their hands before enter the building. You will be placed with a mask, and we will give you gloves that you have to wear while you are in the facility. We are doing all this to minimize the exposure of our employees. You get straight into the room, you get tested, and you get out. The results will be confirmed by you by phone. We also want to let the community know that we are going to engage starting tomorrow in what we call sentinel testing. I'm going to explain that a little bit. So we will go to random places in the community based on criteria that we have established and start testing random individuals. The idea is that could give us a better idea how the infection is distributed in our community. is basically looking for asymptomatic people that may be carriers of the infection. That is an important exercise that we will expand as much as we can as long as we have the resources to do so. The mayor mentioned that we have 32 cases. At this point, because of the number of cases, it's impractical to go case by case with age and all the information that we have provided you in the future. We will ask for the ability to release this information in a table format so that you can have access to it, but we have to check with our lawyers for HIPAA protection issues. And that's all that information that I have for you right now. And also, just to mention to you, we are responding about 600 calls a day, and we are going to be extending our calling center hours to the weekend hours due to the high demand. With that, I would like to pass the microphone to Phil Brown from the airport.
Thank you, Dr. Pino. Thank you, mayors. Good afternoon. Orlando International Airport is operational today. All gates, all terminals are operating. We have scheduled today 1,108 flights. We have had 236 cancellations today, 119 departures, and 117 arrivals. We have one rescue flight scheduled for Virgin Atlantic today, this evening. They will have another on Tuesday and another on Friday. We are continuing our business continuity operations. As tomorrow, we will start rolling out programs for the administrative staff and the support staff at Orlando International, some to work from home. Our first responders, Orlando Police Department, and the air rescue and firefighters are at full staff and operating as usual at the terminal. We are looking forward to continuing operations. The level of passenger activity has dropped significantly. Yesterday, it was slightly over 22,000 passengers screened on outbound flights. That was actually the second busiest in the United States. Overall, the United States, based on the metric of outbound passenger screenings, is off about 75%. That's about the same percentage that we're off. We have 26,000 plus scheduled passengers to be screened outbound today. That's projection. We'll have an update on that later tonight or early tomorrow morning. We have been advised by the Federal Security Director that a fourth TSA agent tested positive. That individual last worked on March 16th, about a week ago. The individuals in TSA that were in proximity are already on isolation or were on isolation. And with that, that's all I have to report. Mayor?
Okay, as you've heard, one of the most significant developments really rests with the testing that will begin tomorrow. Dr. Pino talked about the sentinel testing that will begin, and as well as the operation here in East Orange County will begin tomorrow. We're all really a bit anxious about the testing. Again, we understand that we truly cannot perfect our response and mitigation plans without knowing where we have individuals who are testing positive. So that's a bit of good news that we've shared with you today. Again, just in terms of takeaway, we want those who need crisis assistance with rent payments and the like to contact us tomorrow at the hotline I previously gave you. So at this point, I'm going to open it up for questions, any questions that you all may have. And just as a reminder, if you can ask a question loudly, if it's in Spanish, we do have Spanish speakers here who are able to communicate with you as well. Any questions?
What can the county do to help these local economies recover so we continue to use tourism and taxes?
Well, we certainly will be working with the Orlando Economic Partnership and others within our community to try to map out a strategy for working with our businesses. We will be participating in a joint meeting tomorrow morning to further discuss what we can do from an economic revitalization perspective here within this community. But we still have a long way to go. Obviously, there will be some stimulus dollars that will be flowing from the federal government as well as from the state. We will work to understand how to access those dollars and share information. As a county, as a local government, we certainly will facilitate any of those types of discussions within our community. And to the extent that we can, we've tried to keep appropriate businesses and commerce going within this community during this unprecedented time that we're living in. Okay, so the question was, if our hospitals fill up, is there an alternative plan to be able to meet the needs of the healthcare needs within our community? And so I think it's best that I have the medical doctors, the experts, kind of respond to that. So I'm going to ask Dr. Pino to kind of come forward. What I will share with you is that we have been in communications daily now with our hospitals to ensure that only appropriate individuals go to our hospitals for treatment. They have protocols that they have put in place now to try to make certain that they're able to maintain their business operations as planned and as targeted. So with that, I'll ask Dr. Pino to come forward.
So there is planning in place for the eventuality at the state level. Normally what you do, you have seen it now, is you start stopping elective procedures, and you also at some point could remove out of the hospitals individuals with minor conditions that are being hospitalized, and you can go to the stream of setting field hospitals or places where you concentrate the people who are experiencing COVID-19 if they are not in need of ICU care. But also, we don't have to look too far. You have seen what's happening in Italy, so the system could be overwhelmed, and that's why it's so important to stay home, to isolate, to prevent getting the virus, and at some point, it's safe to assume that everyone else has it. And that's the best practice to prevent from acquiring, is to assume that everyone else may have it. And that's the situation in a pandemic environment.
Dr. Pino, with 600 calls coming into the Department of Health and 150 test kits for tomorrow, what would be the best advice to someone who wants to get in and get tested tomorrow?
It's the best advice that we have given. It's the difference between wanting to be tested and need to be tested. We understand the anxiety for someone who wants to know, do I have these or not? And negative tests sometimes become insignificant in a pandemic environment because you can acquire it tomorrow. So again, prevention is the way to go. And also in a pandemic environment, testing may become irrelevant for the community at large. And why? Because sometimes when it's a widespread of a situation like this, testing possible is insignificant, but it's only significant for those who you have a different treatment path. So the hospitals at some point will be the priority, because deciding what kind of treatment someone can get may depend on the results. So the dynamics may change as the epidemic evolves.
Criteria, can they come in tomorrow and get tested if they're within those 3 criteria you mentioned earlier? And
Until we run out of tests.
What would be the best way for them to get in if they do fit in that group?
The phone number, calling, and the process is in place. They will get a screen. They will be transferred to an epidemiologist, and someone will make the appointment for them. No, tonight is now open. Tomorrow, the phone calls, the calling center is not staffed tonight.
First thing in the morning?
Yes.
Okay.
So how many people can be tested per kit?
1.
So that's
How many people can be tested per kit? 1. It's a collection test kit. And we're only doing nasal swabs now.
Dr. Demings, you just said that you're going to wait to get statistics about testing before you go further with mitigation. But if we only have 150 tests, I mean, we're hearing from a lot of people that want kind of a stay-at-home order that we've seen in other areas of the state and in different states. What do you think of that?
Okay, let me clarify your question about do we have to wait in order to respond to the crisis? We're not waiting, but I think There's a lot unknown about this particular virus, and the more that we know from the testing process, I believe we are able to better perfect the plan of action that we will engage in long term. So this is critical to the overall long-term goal of stopping the virus from spreading. We want to get to the point where when we do these daily updates, there are no new cases. We're not yet there. And so that's why this team of experts and professionals are coming together, because that's where our ultimate goal is headed.
Do you think, though, if we know that the worst is yet to come, we should be trying to do more right now to lessen that?
The worst may be yet to come. We know that the numbers are likely going to continue to climb for the foreseeable future, which is why we have taken all of these various precautions that have been taken in consultation with many people in this community. Obviously, whenever decisions are made to close down theme parks, close down certain businesses, enact a curfew, we're being very deliberate and making some decisions in a timely manner in advance of knowing whatever we are to learn from the testing results. So we are being very judicious in this community to try to abate the large gatherings, and we know that through the gatherings that helps to spread the virus, and so we've been very intentional about it. I think we've done the best that we could do given the circumstances at hand, and we're going to continue. I know the commitments of our local governments working with our state and our federal authorities. We have one goal in mind, and that is to make certain that this virus no longer continues to spread.
The governor isn't really interested in doing a stay-at-home order. Would you ever consider doing that for Orange County?
The question is, would we ever consider a stay-at-home order here for Orange County? That's a possibility. We're not yet there yet. But as we learn daily about this particular virus and the spread, we could get to that point. We will only take that action if we think that it's absolutely necessary in response to the spread of the virus.
Where on Trail is that testing site going to be tomorrow?
Okay.
Is it by appointment only?
The testing location is by appointment only, and in terms of the location, I'm going to ask Dr. Pino. It's probably best to come up to kind of talk to you again. He shared with you kind of the process, but in terms of what happens when you make that phone call, who do you get, who do they get the referrals from? I'll let him talk to you about how they are going to make that priority.
Spanish, when you finish in English, you can say
Sure.
in Spanish.
So the location, we are not going to disclose the address exactly because tomorrow will be the first day, and we don't want to be overrun by a large number of people that may affect the local community there. But people who will get the appointment will get the address where to go. It's a clinical space that we have there, and at some point we will invite the press to see the clinic and how the inner workings are. La pregunta fue que dónde está localizada la clínica. Mi respuesta fue que no vamos a dar la dirección exacta de la clínica porque no queremos que las personas que no tienen cita vayan al lugar y tengan que regresar. We are going to have security presence in the area, so those without appointment will be turned away. It is important that we do this in an orderly manner and that those who need the test the most will receive it. La respuesta a esa pregunta también fue que si no tienes cita no vamos a aceptarte en la clínica y es importante que tengamos prioridad en las personas que más necesitan el test. El número es 407-723-5004.
Can you talk about the sentinel testing again? Talk about the process. Is it just random door knocking? What neighborhoods you're going into, and what is the importance of it?
So it can take many shapes. I think that we are going to use a mixed method. What probably we will do is we are going to test some of the areas that are closer to the individuals who have been tested positive. So that's a geographic approach. We will map using our scientists at work, and we will map where the individuals are, and we will do a radius on those areas and start testing individual just randomly and say to someone, would you like to be tested? And as random as possible. So with that, what we use those numbers based on the number of population that we have in the county is we can make calculations. What are the possible number of people who may or may have already the infection in the county is for planning purposes. And it goes along with what the mayor correctly was saying, is that we have a measured approach and we will take steps as the epidemics evolve.
Is that the best way of using the resources of the tests, you believe?
Those are different resources. And of course, we will not take away from what needs to be done, but also it's as important as testing people, because then it gives us an idea of community widespread. The people who are going to come to us are the people who are feeling sick or concerned, but we also want to know about those who are not coming to us, because those are coming to us, we may have a better chance to stop spreading the infection, and those who are not coming are of a concern. Same test.
So with the shortage of the testing sorry, I make that possible, where are these resources?
These are coming from the state.
And so you guys are using that on that rather than having.
Those are two different piles, if you want to call it. Now, sentinel testing is not massive. It's not a large number. We will develop an equation. It could be just 10 tests. So it's not a large number of tests.
And with the supplies that we're hearing stories about medical professionals reusing supplies with the PPE that was delivered in the shipment did not meet the needs of our hospital right now. How would you characterize the amount of supplies our hospitals have? Enough? Is there shortage going on now?
The question was the supplies that are coming into the county, how they are getting distributed to the hospital, how is that priority set up, and do they have enough? And I will let the county answer that question, but emergency management is in charge of those processes.
Okay, with that question first, let's take that one regarding the supplies. I'm going to ask Dr. Martinez to come forward. We have received some shipments in today, and I'll let her talk a little bit about the supplies and the equipment, how it will be distributed.
Thank you, Mayor. We did receive PPEs. We received N95 masks. We received gowns and gloves of a very small amount, if we consider the need, about 9,000 or so. And those would be distributed to the health providers and the agencies in the community that have expressed that they have a shortage. And the numbers will be based on what that formula is of the shortage versus what we have to make sure that everybody does have access until we get the next shipment, which should be following pretty soon.
There still will be a shortage after the shipment?
There will probably still be a shortage, but all we can do is what we receive, that we will be able to distribute, make sure that everybody that needs it right away will get it, and we understand that there are other trucks on the way as well. So we'll hopefully be able to cut the number of days with a shortage.
Doctora, ¿usted sabe si los hospitales y el condado tienen suficientes equipos de respiración y ventiladores en caso de que haya un trabajo abrumador o muchos pacientes enfermos? ¿Cómo están de equipo, de ese tipo de equipo?
The question was if we know how the hospitals are doing in terms of respirators and emergency supplies. As far as we know, let me say it in English first. They are doing okay, and that is why right now what they're trying to do is to reduce the transit or the traffic of individuals that do not need emergency care in their hospitals. And in Spanish, sabemos o tenemos la información de que hasta ahora, hasta este momento, están bien, tienen los recursos que ellos necesitan. Por eso es que están pidiéndole a las personas que no tienen una necesidad de emergencia que no se presenten al hospital.
Okay, there was one question, sir. I don't know if did they answer your question?
Pino, quisiéramos saber para el próximo miércoles, cuando habiliten el Centro de Convenciones de Orlando, este centro móvil de pruebas, ¿para cuánto va a tener capacidad para ese primer día para atender las pruebas?
I will let, yo dejaré que el county responda esa pregunta. Yo no estoy personalmente envuelto en las actividades del sitio, y aunque sé la respuesta, sería irresponsable dar una respuesta de la cual yo no estoy siendo parte.
Here in Orange County that have surprised you, people who might be younger, without pre-existing conditions, anything like that, or just mostly elderly people with pre-existing conditions?
No, what really surprised me is how low our cases are. The number of cases that we have is really low for the population that we have. This is not in any way to mean to relax and not do what we have to do. But your question was how surprised I am. Now, or what surprised me? Now, have in mind that the cases that we may see today could have been acquired up to 14 days ago. So that's what is critical about this epidemic, is that what you see today is what happened perhaps 2 weeks ago. So as we move forward, we are going to see cases that were contracted today, but we will not see them until 2 weeks. So that's why this measured approach that the mayor was describing is so critical. Not to overdo it, but not to underdo it either. So we will respond as needed.
So the question is, apparently there have been some media inquiries about why hair and nail salons are allowed to remain open, and perhaps they are not practicing social distancing. Through these types of events, we try to communicate with the public. We want to gain compliance in that regard before there's any specific directive that comes out. Primarily, those entities are licensed by the state of Florida through the Department of Business and Professional Regulations. And I did have a conversation yesterday with the secretary regarding that. And what he shared with me was that they are going within the counties throughout the state doing some spot inspections to gain compliance. And so we will look to the state in that regard so that there's uniformity across the state and certainly within our counties and cities as it relates to that. As we move forward and we learn more about the actual business practices that are occurring in this community, we may have to make some additional decisions that fall up under my authority. There's questions about where, as a county mayor, my authority begins. And again, we do have communications with the state, and we try to have unity throughout the state and uniformity throughout the state on how various things are applied. So that's what I would say to you is stand by on that one. We hear you. We'll take it into consideration. And yes, pardon me? Yes.
More concerns about what happened yesterday.
Okay. The question is, do I have some concerns about what happened last evening at the jail? Well, absolutely. That is something that is being investigated criminally by the Florida Department of Law Enforcement and the other local law enforcement agencies that were involved in terms of the actions or inactions of staff related to that. In addition, the jail itself is an operation that falls under my authority here within Orange County. We are reviewing our policies and procedures, our training, and all of our various protocols. I have to say that in that one instance, that impacted first responders in this community because it impacted correctional officers, it impacted local law enforcement officers, a deputy sheriff, and it impacted a healthcare worker and nurse that worked at the jail. We were fortunate that there was really minimal injury to any of them, and so with a bad situation, we had probably the best outcome for all of them involved, but it has caused us to really review all of our policies and procedures. And so my thanks goes out to all of those men and women who work in those specific areas, but also I have to say we have those unsung heroes right now since we're talking about a world health crisis. Our healthcare workers, doctors, physicians, nurses, and all of the support teams who are working in this endeavor to keep us all safe. We all owe them a debt of gratitude, and certainly I owe those who survived that terrible tragedy or ordeal, I should say, last night. We owe them a debt of gratitude, but our commitment is to act swiftly, and make adjustments and changes where we need to prevent that from ever happening again.
Mayor, how has the curfew gone the last couple of days?
The question is, were the officers, the law enforcement officers who fired their weapons as customarily done, they were put on alternative duties pending the outcome of those internal investigations with their respective agencies. In terms of our staff internal to the jail, we will, through employee assistance and other crisis counseling, make certain that our staff is administered to and provided everything that they need to deal with just the emotional impact of having gone through that. So we're doing that. We're taking a look again at all of our processes and procedures from a security perspective to make sure that what happened last night doesn't happen. I'll go to one last question and then we'll conclude this.
Can we talk about the curfews the last 2 nights? I know the city of Orlando said they issued about 45 warnings night one. Orange County night one said they didn't have any issues. What have you been hearing from either the chief of police or the sheriff?
Well, we had a conference call earlier, and the sheriff said that last night there were no additional arrests related to the curfew. And sometimes there's a little bit of a lag because we do have to communicate to the public when we institute a curfew. And so it takes time for people to understand when a curfew is in effect. And here within Orange County, that remains tonight and likely will remain for the foreseeable future. So people are complying with the directives that have been given. Again, the goal was not to make it a punishment for people, but to really gain compliance to reduce the social gatherings that cause us all the concern in this community. So thank you all very much for being here, and we'll likely come back within a day or so unless something else happens and we have to do it sooner. Thank you very much.